Before we start talking about procedures and tests and other things that Medicare endorses through its concept of thorough, I just wanted to talk about one misconception that's very common when I give talks about this. And that is that people are living a lot longer because of technology and because of the procedures that have come out in the last 30 or 40 years. The truth is that much of the longevity that's occurred in our society occurred before this happened. If you look at the heart, for instance, stenting and balloon angioplasty and even bypass surgery has not really made any dent on how long people live in terms of heart disease. People were living longer for a lot of reasons. This includes diet, it includes awareness of when heart problems occur so they get to the emergency room quickly and get medicines. It includes the medicines themselves. We have a lot better medicines for heart disease. It also includes the fact that less people are smoking and people are eating well and exercising better. So there are a lot of factors that come in, but all that increase in longevity occurred before this first stent was even put into somebody's heart. And it's been very flat since stenting started. So we can't really ascribe to stenting any kind of increased longevity. In fact, as many people are hurt as harmed by stenting, as we'll talk about later. Also, the advent of good infection control has made a huge difference. The idea of public health has made a big difference, which is why people in this country live longer than in other countries. We're also very good at taking care of very critical illness. Our ICU care is better. So when someone gets very sick, we can take care of them. The Ebola crisis has been an example of that, where people with Ebola in this country have a much better chance of surviving in other countries, and it's not because of any medicine or technology, it's because of basically good nursing care. Nursing care has made a huge difference in how long people are living. So when we look at mammograms and we look at bone density machines and we look at heart stress tests, we look at the explosion of CAT scans and MRIs that have just filtered across our landscape, and we really study those, we find that none of them have caused increased longevity among our population. They've increased our cost, they've increased false positive testing, they've certainly increased the number of diseases people walk around with. We could label you with anything now based on the amount of tests we have. But in terms of how long people are living, that's not the reason. So as we talk more about each of these tests and procedures, we'll talk about how they help and hurt people, because they do both, and we'll talk about just how necessary they are.